Hi, this is Dr. Kim, and today I'm going to cover the part three of a question that I got, which is about ADHD. And ADHD is a condition that is very common, I think, especially in um, children, professionals, students. I almost think it's another epidemic. So the topic is functional medicine approach to optimal treatment of ADHD, and we're looking at serotonin, norepinephrine modulation, and endorphin modulation. So in order for us to talk about the modulation, we should know what serotonin versus um, dopamine does. And dopamine really looks at the mood stability and overall well-being feeling. It regulates mood, sleep cycle, appetite, digestion, and social behavior. And if you have not enough of it, depression, anxiety, and irritability, high levels of it is too much of it can be serotonin syndrome, which is one medication for SSRI or selective serotonin reuptake inhibitor is combined with other medications like tricyclic or MAO inhibitors or methylene blue in high doses. So in dopamine, it drives motivation, reward, and it's also reinforces pleasure, attention, goal seeking, and fine motor control. So low levels, we talked about this, that the absolute lack of dopamine is not ADHD. ADHD is probably relative lack. The absolute lack is Parkinson's disease. So, and ADHD as well is associated with it. And high levels of it is problems like impulsive behaviors that come with addiction, and schizophrenia is one of them also. And key difference, I think, is that serotonin fosters calm and satisfaction. So think about like overall happiness, and um, dopamine energizes and activates. So think about more of um, being being stimulated, being stimulated, and um, versus calm and satisfied for serotonin, and dopamine for energizing and activating. If the serotonin has influences in, of course, in the brain, gut, and sleeping, along with melatonin, whereas dopamine controls movement and reward-seeking behavior, attention, focus, drive, and the serotonin can help with impulsivity control. Dopamine boosts motivation. So combination of both actually is not bad for ADHD. So the question then becomes, can you modulate serotonin, norepinephrine, and can that help with ADHD? So there was a study that was published in 2024 by Des Foley and others looking at efficacy, safety, tolerability of serotonin, norepinephrine reuptake inhibitors in controlling ADHD. So it was a review study and meta-analysis, which means it's looking at multiple studies, and they found that duloxetine and venlafaxine can be used to treat ADHD, and it's well tolerated. And they said that duloxetine can be more potent in reducing ADHD symptoms, but it also said that for women, venlafaxine may be more effective, and it's more effective for inattentive symptoms of ADHD rather than hyperactive symptoms. So that's the answer, is that yes, we yesterday we looked at can Wellbutrin can, because that's also a norepinephrine dopamine modulation, but it's at a slower pace, can it help with ADHD? And the study showed that yes, you can use Wellbutrin if you're not tolerating, and if you have depression, that may be even preferred. And now we have additional tools that you can also use serotonin, norepinephrine modulation. So we're gonna like turn a little bit and look at dopamine and endorphins. And dopamines, we talked about the idea of dopamine for motivation, reward, and movement, fuels pleasure, motivation, goal-directed behavior, regulates movement through basal ganglia, and that's more important for the Parkinson. But it enhances focus, learning, anticipation of rewards, and produces short bursts of pleasure when we pursue or achieve something meaningful, whether it be food, accomplishment. So the interesting thing is that endorphins are not a neurotransmitter. They are more of neuropeptides, and but the thing is that it plays a very interesting role. That endorphins have been known to do many things, but two things we'll talk about is easing of pain, because it's a natural opioid, and when we are in pain, our body can use endorphins to tackle the pain. But it also is a bit like dopamine in that it can boost mood, reward, and especially when people are engaged in things that they love doing, like the classic is the runner's high, then you get euphoric state. Sex would be another way. Some people, meditation would be another thing. Some people just doing their hobby that they love doing, they have this euphoric state, and so that's really very interesting, because you can also modulate. If you could modulate endorphins, then you would be able to theoretically modulate the ADHD. So and the modulation of the endorphins is done many ways. One way to do it is exercise, meditation, engaging in prayers. But the key thing is that it has to be pleasurable to the individual. So you can't just say everyone go exercise or meditate, and it has to be something they find pleasurable, and the euphoria will get triggered by endorphins. There's a second way to increase endorphin, and that is the use of low dose naltrexone. And over time, if you use low dose naltrexone and increase the dose, it will kind of coax the body to produce more endorphin, and that would be another way. And we will end this segment, and tomorrow we'll do part 4, where we're going to talk about functional medicine management of ADHD. Thank you. And if you learned something, please give me a like and consider subscribing to the channel. Thank you.